In this video, I'm going to talk about gout. We're going to look at what the condition is, what the symptoms are, why people get it, and how we treat it. So I'm Stephen Bunting. I'm an MSK physiotherapist and sonographer based in the UK. Welcome to the channel where we explore the common MSK problems that normal everyday people experience and the evidence-based treatments that can help. So let's dive right in with the first question. What exactly is gout? Well, gout is caused due to a buildup of a chemical found in the blood called uric acid. We all have uric acid in our blood. It's produced when our body breaks down chemicals called purines, which are found in certain foods and drinks, particularly red meat, oily fish, yeast products, and alcohol, especially beer, but also spirits. And if the uric acid in our blood reaches a certain concentration, then it can start to crystallize and form tiny sharp crystals that have a tendency to become concentrated in the joints. The crystals form more easily in colder temperatures, and they also need a roughened surface to crystallize on. And the coldest, roughest joint we have in our bodies is the MTP joint of the big toe. It's cold because it's far from the warmth of our body, and it's rough because it's one of the earliest joints to succumb to osteoarthritis. Gout can theoretically affect any synovial joint in the body, but it's the colder joints that are most commonly affected. The toes, the foot and ankle joints, the finger joints, the wrists, and the elbows. When gout affects the joints, it tends to come in episodes called gout attacks, and the symptoms of a gout attack are pain, redness, and swelling around the joint. As I mentioned earlier, the big toe MTP joint is the most common joint affected by gout, and the pain can be really severe. This picture by British artist James Gillray in 1799 is called The Gout, and it's his interpretation of what a big toe feels like during a gout attack. The other common symptoms that you can see with gout are soft tissue swellings called bursitis. This time the uric acid crystallizes in tissues called bursas, which we have around many different joints in the body. I've done a separate video all about bursitis, which you can see up here and in the description below. The bursa over the tip of the elbow is the most commonly affected in gout because it's a fairly cold area of the body. This is called an olecranon bursitis, and they can get quite large. The other area that we tend to see gout-related bursitis is around the front of the knee. In late-stage gout, uric acid crystals can also build up under the skin and around the internal organs. These are called gouty tophi, and you can see an example of them around the end joints of the fingers here. They have a pasty, whitish appearance, and they can cause further damage to the underlying joints and any body organs that they've built up on, particularly the kidneys, and so kidney failure is another symptom of late-stage gout. Centuries ago, gout used to be called the disease of the rich because of its association with diets high in red meat and alcohol. These days, however, we find that anyone can get gout. It is more common in men, and particularly in men who drink too much alcohol, particularly beer. So if you are a heavy drinker with gout, then do take this seriously as a warning sign that you really do need to be reducing your alcohol levels. But then again, you could live a perfectly healthy lifestyle and still have gout. It just might be that your body isn't very good at clearing uric acid from your system compared to other people. If you think you might have gout, then you really do need to see a healthcare professional, because untreated gout can be a serious problem, not only to the joints, where it can cause considerable damage and arthritis, but as we've discussed earlier, it can also damage the internal organs, particularly the kidneys. Also, the symptoms of a gout attack can be very similar to a severe joint infection, so a simple blood test can check for infection and also test the uric acid levels in your blood. Testing a sample of joint fluid is the most accurate way of diagnosing gout, as you can see the tiny uric acid crystals through a microscope. Also, imaging the joint with X-ray, ultrasound or MRI can look at the joint surfaces and check to see if there's any underlying damage or inflammation. If gout is confirmed and it's your very first episode of pain, then it's usually just treated with anti-inflammatories and sometimes steroids. A drug called colchicine is often used for a few days to settle down an acute gout attack. You also need to then look carefully at your diet and try and cut down on any of the foods we mentioned before, and significantly reduce your alcohol intake if that's an issue for you. If further attacks continue to occur and your uric acid levels continue to be raised, then you might need to start using a uric acid lowering drug, which is then usually taken for life. The two main drugs used in the UK are allopurinol and febuxostat, and these drugs are usually very effective at keeping symptoms under control for the long term. In most cases, gout is managed by your family doctor or other community MSK professional, but if you have more severe symptoms or the usual treatments aren't working, then you might need to see a rheumatologist, who are the specialist doctors who treat gout which hasn't responded to the usual treatments. And if you have significant joint arthritis as a result of gout, then you might need to see an orthopaedic surgeon about the option of joint replacement surgery or other surgical treatments. Okay, well that's about it. I do hope that you found the video helpful and informative. If so, then please consider liking it and subscribing to the channel, as this really does help get the information in front of more people who might also benefit. So thanks very much for watching, and bye for now.